evening, ladies and gentlemen. Good evening. Good evening. Welcome this evening to the Ames Public Library. We are thrilled to have you all here. The Ames Public Library is pleased to present a wide variety of programs that connect you to the world of ideas, such as this evening's forum on homelessness, presented in partnership with the League of Women Voters. My name is Vanessa Olson. I am an adult services librarian here at the Ames Public Library. I'm happy to be your host for this evening, so if you need anything to make your stay here at the library more comfortable, please don't hesitate to flag me down. We have restrooms out in the lobby. We have a selection of books available on the side table over there for you to check out. And we also have a poster exhibit over against the windows about the city's Homeless Outreach and Support Team, or HOST, which is a new initiative to help homeless individuals in our community, which I would encourage you to check out after this evening's presentation. So without further ado, I would like to introduce Ann Kinsel, who's going to be our moderator for the evening.
Thank you, Anessa. Good morning, everybody. Good morning. I was on the radio this morning at 7 a.m., so it's been a long day. Good evening. Okay, so I'm Ann Kinsel. I'm the co-president of the League of Women Voters with Carolyn Klaus, and I'm going to moderate tonight's forum, a 360-degree view of homelessness in Ames and Story County. For those of you who might not be familiar with us, the League of Women Voters is a nonpartisan political organization dedicated to encouraging citizens to be informed participants in their government at the local, state, and national levels. Tonight, we're going to have presentations from 4 speakers that will focus on why homelessness is a growing concern, the complex causes of homelessness, homelessness's impact on individuals, community-wide effects of homelessness in Ames and throughout the county, and the need for informed action. But before we begin, I want to remind everyone to vote on or before Tuesday, November 4th. That's a big thing with the League of Women Voters. There are various ways to register to vote. You can download a voter registration form from the Story County Auditor's website. The deadline for submitting a voter registration form is Monday, October 20th. Or you can register tonight. I think we have registration at the back. Or you can register to, we don't, okay. Or you can register to vote on election day at the correct polling place for your address. For that, you must have the proper ID. Absentee ballots can be found on the auditor's website, and October 20th is also the deadline for submitting absentee ballot requests. If you've already requested an absentee, you have until Tuesday, November 4th at 5 p.m. to have your ballot inside the auditor's office in the administration building, 900 6th Street, Nevada. Ballots not delivered by 5 p.m. on election day will not be counted. And I also want to remind you that this forum is being recorded for upload on YouTube and zoomed galaxy-wide by the library. And you can always go, if you want to catch up on this again, or send your friends to the League of Women Voters Facebook page in a few days, and it will be rebroadcast there. So our ground rules are simple tonight. Don't interrupt. We'll be asking questions at the end, okay? Before I continue, I want to thank our presenters and each of you here and the folks participating virtually for being part of this important community discussion. Each of you has invested your most precious resource, your time, for being here this evening. And I hope that the investment ends up being a good one, and I promise to do my best to make that happen. Let's be honest, the issue of the unhoused has caused some tension in communities locally and across the United States. Tonight, we're here to listen and learn about the complex problems of the unhoused and persons who are experiencing difficulty in securing permanent housing in Ames and throughout Story County, and also how, as a community, we can respond positively to the varied needs of the unhoused. This conversation follows the City of Ames publication of a strategic plan, the Conversations on Homelessness, Ames and Story County Strategic Plan, that was released in May of 2025 and updated in the summer. We'll come at these issues with different perspectives. What I do know is that we can agree to disagree civilly if we focus the evening on learning. Let's begin. We've invited 4 separate parties who intersect with issues of the homelessness and the unhoused in Ames and Story County, each of them in a different way. First, our 4 guests: Ames resident Dave Carter, Adult Public Services Manager at the library Megan Klein Hewitt, Kathy Pinkerton from the Host Team Outreach, and Josh Oren, Housing Stability Case Manager Liaison at Story County. The presenters will be followed by an audience Q&A with presenters taking questions from those in attendance here this evening. And then we'll have a brief summary thinking about the way residents can be involved. And I want to say that it's kind of ironic for me here because when I was a young attorney in 1988, I will date myself, my first written opinion that I was asked to do was what to do about the issue of the homeless in the Fresno County Free Public Library System. And here I am so many years later in the Ames Public Library, and we're addressing, in many ways, the same topics. And so that did cause me some reflection that while we may be thinking that the problem is relatively new to Ames, it is a problem that has existed, an issue that has existed for many, many years in our country and our state. So let's start with Dave Carter, who will give us a perspective on living in Ames and the homeless presence with a focus on his residency in the central core of Ames, including historic Old Town and the single-family overlay district. Dave.
Okay, thank you. So I was asked to do this several months ago, and how's the mic?
Bring your mic down.
How's that? That better? There we go. So I was asked to do this several months ago, and I thought, sure, I can be glad to say what I'm thinking. And now I just, as the time approached, I needed to figure out what I was thinking. So having done that, I live 2 blocks north of here, and my wife and I raised our family there. We've lived there 33 years. I was involved quite a bit in development of the historic district, and then subsequently in rezoning efforts and zoning single-family conservation district in the area, and trying to preserve the character of the area as single-family residential. And that effort was primarily in the 90s and the early 2000s, and as I've grown older, I've had less involvement with city government, but kids had left home, my wife and I in the big house with a dog, and my wife walks the dog every morning. And because the dog doesn't really get along well with other dogs, she likes to walk the dog early. And so and she's been doing that for a number of years. I would say about the time of the pandemic, 2020, 2021, her typical path would be to walk the dogs south, down here around downtown, Banshell Park, down Main Street, around past City Hall, back. She began to encounter more and more homeless people in the downtown area, and you know, it was a gradual increment. First few. Excuse me?
Did they ever hurt her?
Well.
Oh, it was just like an inconvenience
Yeah.
for her.
Yeah.
Okay, thank you.
We'll
have
ask questions
after,
later.
okay?
So,
Thanks.
so she's experienced an increase in the number of homeless people, and that seemed to increase year over year. 2023, there were quite a few. 2024, last year, then it got to where there were enough people in enough places that she was no longer comfortable walking typically where she liked to walk. And that's when in that same summer, I decided I would partake of swimming at the Buyer Pool over lunch. And they had open swimming, and so I'd come down to the library, get on the bus late in the morning, and head out to Buyer Hall and take a swim over noon hour and come back. And at that time, in the summer of 2024, frequently then there would be half a dozen people here at the library, some camped out, some just passing time in front of the library, some across the street at the Elks Lodge. And so it was a noticeable difference in the number of homeless people. It really became concerning to me then, later in the fall, 2024. This came up as a zoning issue, and I got involved with that, but it also came to my attention that there was an assault, and it so happened that it actually was just a couple hundred feet from my back door. And it turned out...
Like homes.
Excuse me, we're going to take questions at the
Yeah,
end.
and it turned out that in this instance, a gentleman was walking his dog in the morning and was assaulted and knocked down and kicked and wound up with some broken bones in his face and had to go to the hospital, get treated. And that alarmed me because that very easily could have been my wife. So that's my direct experience. I've been involved with this thing to the extent it was possible. Ann mentioned a strategic plan, and on page 25, I don't know if anybody's read the plan, but it's a good plan. It says, in Story County, there's a growing need to address the presence of individuals experiencing homelessness in public parks and around the public library. It is important to maintain public spaces so that they are accessible to all residents. However, they are not designed to meet basic human needs, such as shelter, bathing, or laundry services. The extended use of public spaces for housing needs often leads to increased tensions between housed and unhoused residents, as well as sanitation concerns and safety challenges for both those experiencing homelessness and the housed public. Relocating individuals experiencing homelessness from these areas is part of ensuring they are connected to appropriate housing options, outreach services, and case management. This approach not only supports community well-being, but also ensures that public spaces remain welcoming and functional for everyone. So it's my hope that this strategic plan can get implemented, and some of the other people here may have more optimistic news on that. I myself, at this time, my thinking is I'm rather pessimistic. I did not find our community prepared for the amount of homelessness that increased recently. I did not find the city government and the elected officials and the staff prepared to address the issue. The problem itself is a long-term problem and stems from years of underfunding of mental health needs and early educational needs and case management. And until those things are addressed, and our community can't do that. That's more of a state problem. Until those things are addressed, I think the problem's going to remain with us.
Thank you, Dave. Okay, our next speaker is Megan Klein-Hewitt, and Megan is the Adult Services Manager at the Ames Public Library, where her work focuses on building positive relationships with the Ames community and creating community-centered collections, services, and programming. Prior to moving to Iowa, Megan worked at the Omaha Public Library for 8 years, most recently as the Borrower Services Manager. Megan is going to discuss the intersection between the Ames Public Library and the Ames unhoused population, focusing on the role of the library in what has become known as the Ames homeless ecosystem. Megan?
Thank you, Ann. And thank you to the League of Women Voters for inviting the library to participate tonight. I'm usually the other side of this situation. I'm usually doing Anessa's job, so it's great to be able to chat with you all about some of the other amazing work that our team at the library is doing. You know, libraries and homelessness have been intersecting for a long time. And, you know, you might have seen things like the movie The Public or read articles about libraries who have hired social workers to help alleviate some of the perceived burden on library staff and provide specific expertise in assisting library users to connect with social services. Libraries across the country are trying to determine the best way to manage serving the diverse public that make up our communities. And Ames Public Library are in no different position. Every library in the country sets their own policies and procedures with their library board or commission. And libraries have overarching principles that guide our work, but ultimately every individual public library is responsible for responding to their own community's needs. And that's intentional, right? Like when we look at what the community here in Ames needs, it's not the same as Iowa City or Lawrence, Kansas, or Chapel Hill, North Carolina. Those are all communities we look to as being similar to ours. You know, they have large universities and a relatively similar town-gown population size. But the needs of Ames are unique, and we would never assume that what works in Iowa City is going to work here in our own community. We do talk to one another. We review each other's policies when we're considering making changes to our own, and we attend professional development opportunities to learn from each other's experiences. We share best practices with one another. We receive legal information from the State Library of Iowa and their legal librarians, and are guided by conversations with the Ames City attorneys, the police department, and the library board. But ultimately, we're writing our library's policies and procedures to best serve our community here. So tonight, I'm going to share a little bit about the library's philosophy of service and how we are working to serve our community experiencing homelessness, and then talk a little bit about our conduct in the library policy that guides our safety and security approach. So APL believes that the public library is for everyone. We ground our work in the library's Welcoming Our Community statement, which says, Ames Public Library is committed to creating a welcoming space that recognizes the inherent dignity of every person. We honor the unique backgrounds, experiences, and perspectives of customers, staff, and the community as a whole. Ames Public Library works to reduce barriers to access to the public, provide a safe environment for community members, and foster a supportive workplace. As such, all employees will work to create a culture of respect and dignity for staff and customers. We truly believe that everyone who enters the library should be treated with dignity and respect, and that there is not one right way to use the library, that there are many different ways to use the library successfully. And library staff are in a position where we're constantly trying to balance a wide variety of needs. You know, sometimes individual needs come into conflict with one another. But the reality is that a lot of people in our community are experiencing a lot of really hard things, whether that's poverty or lack of housing, domestic violence, struggling with mental health or physical health challenges, and all of those things impact the way that a person approaches the world, and that changes the way that we interact with that person as library staff. So we have moved to find better ways to serve some of the members of our communities who might need some more support. So one of those is preparing information that's frequently asked for. You think of the library, you think of information, right? And that's true for everybody. A lot of people, when they come to this community, we are their first stop. Or just the first place person thinks of to come for information about local services. So our staff have prepared information like walking maps to local emergency services to help folks that are new in town find their way easily, and wallet-sized street cards for folks that have local food, shelter, clothing, and medical information so that they can keep that handy and on their person. We also update information about local social services constantly, because it's always changing, and provide copies of that information to folks who are looking for it. We offer pre-printed forms to apply for local social services like Story County General Assistance and SIRHA. We've also added supply kits at all of our service desks. So those include items that you might find yourself in need of, like menstrual supplies, incontinence pads, diapers, deodorant, soap, all kinds of things like that. Those are all items that we think are essential in helping people successfully use the library and stay in our space. For example, rather than have a family leave because they don't have a spare diaper, they can just borrow one from us and stay in the library and continue their visit. And creating that environment is important to us. We offer the checkout of hotspots, tablets, and bus passes. So people need access outside of the library too. We provide hotspots and tablets to help families close the gap to internet access so that they can work, complete schoolwork, and apply for jobs from home. We also helped facilitate a $25,000 Story County community grant last year that provided hotspots and tablets with data service to all Story County libraries. And those are currently either have rolled out or are in the process of being rolled out. Transportation is another gap that we've seen across the community, and we offer monthly bus passes for checkout to help close that gap as well. We bring in different service providers to offer office hours here at the library. So over the last probably 2 to 3 years since we started offering office hours, we've gone and had a number of organizations come through our doors and use our space to meet with people, offering professional support on site. Right now, we're hosting Mary Greeley Medical Center's behavioral health staff, Susan, who is part of the host team. Sometimes she has other host team members with her. Sometimes she has the ARCH team, which you'll probably hear more about. While other libraries have hired social workers, we've really found that this arrangement works well in our size of community, and we're kind of cutting out the middleman by directly connecting people with the services that they need. And last but not least, we really work hard to create relationships with people, especially those who are experiencing homelessness. We really consider creating relationships to help us better understand everybody in the community, but particularly those whose needs are maybe the least met. We do a lot of listening in our job, whether that's trying to help somebody find the next book that they want to read, or helping somebody figure out what social service is the right place for them to go to next. We do a lot of informal referrals to agencies, kind of trying to point people in a direction that might be helpful, because that's kind of where we sit best in this situation, is helping connect people. We see the library as a place for everyone, and managing different people's expectations is a really fine balance. I know that safety and appropriate use of the library is a big part of the community conversation around homelessness, and we do work to ensure the library is a safe place for the whole community, and do so by enforcing our conduct in the library policy that guides expectations for behavior inside and outside the library on our grounds. We have a person in charge team that's made up of the library's supervisory and professional staff. Anessa is the lead on our person in charge team, so it's a group effort. This group is responsible for the safety and security of the building, staff, and library customers. A staff member is responsible and on call all hours that the library is open in order to manage any situation that might arise. That team is trained in CPR, AED, first aid, mental health first aid, stop the bleed, Narcan, and formal de-escalation training. We walk through the building regularly during library hours and manage facilities emergencies, help people who are having mental health and physical health crises, de-escalate situations, and interface with colleagues at police, fire, ARCH, host, and any other organization that might come in an emergency situation. We have a system for managing conduct in the library violations. We always start with conversation, and for the lowest level of misconduct, and will trespass people in situations where that's appropriate for criminal behavior. We always focus on behavior, and we want to make our expectations clear from the beginning. We want people to be successful and be able to be here in the library. And except for the most severe situations, we will always give a person the chance to correct behavior before moving on to any sort of consequences. So like everyone else in the community, we've been on a bit of a journey over the last couple of years to try and create and maintain strong boundaries around the use of our space. And we've done that through consultation with city and community colleagues so that we can set appropriate boundaries that are also enforceable, which is important. We began doing walks around the building, picking up litter and connecting with folks who might be sleeping out. We're actively messaging that library grounds and the exterior are not an appropriate place to sleep and enforcing consequences when that behavior continues. And we've done other things like resetting our expectations around food and drink in the building, upgrading, my time is up, upgrading our security cameras, and just trying to put into place some, like I said, some boundaries that are both enforceable and help us create an environment that makes the library accessible to everyone. We really try to live in that welcoming the community statement and want to create a space that's welcoming to everyone and want the library to continue to be a resource for the whole community.
Thank you, Megan, for explaining so well how the library functions in our community. Our next presenter is Kathy Pinkerton from the Salvation Army and the Host Team Outreach Group, and she's going to provide us with information on the Host Team and the community partnerships involved in homelessness, various actions and plans, as well as support programs available at the community level. Kathy.
Okay. I do have handouts, maybe not enough, and I'm not sure the best way to do that. So maybe when we're done, if you want one, you can take one. I'm just going to briefly touch on what's on there. HOST does stand for the Homeless Outreach Support Team. We have what we call 5 core members, and so that is me with the Salvation Army. I'm kind of part of it because we provide shelter in the form of hotel vouchers. We also partner with the Bridge Home, who is the other shelter agency. There's Access that provides shelter for victims of domestic violence or fleeing domestic violence, sexual assault. And then Youth and Shelter Services did do some shelter. They don't at the moment. They've kind of gone a different route, but they still do housing programs for unhoused youth. So they're also... Why? Sorry, I'll do your questions. We're done.
Why did the Youth and Shelter Service like...
I don't know.
Let's hold
I
our
don't know.
questions till the end, okay? Thank you. Thank you.
You gotta stop talking.
The reason we formed HOST is we realized that as agencies, we were running into each other at places anyway. They were coming in maybe sometimes to United Way and saying, I need help. They were coming into the library and saying, I needed help. And we might get called out. And we decided we could be better serving everyone if we partnered on a consistent basis, on a planful manner. And that's where HOST was formed. We officially formed in November of last year. Shortly after that, the City of Ames did give us some flex funding to be able to assist with some things that other agencies did not have. And then the Salvation Army also received a grant from United Way to do something similar. What we were finding is someone who's unhoused can't get into an apartment if they don't have an ID. They can't get an ID if they don't have their birth certificate. If they've had to go from place to place and try to keep some things safe, unfortunately, a lot of times documents get lost. And so that was a barrier. If they don't have transportation, they didn't have a way to get to Department of Human Services. They didn't have a way to get even to the library when the library was giving out bus tickets before bus passes. We would provide bus passes, bus tickets. We also started doing specific outreach hours at the Romero House. That's a place where people can go and do laundry, they can get lunch, they can get a shower so that they're not bathing in the bathroom library, that sort of thing. So again, we worked with multiple agencies, so that's what we call community partners. So we've got the 5 core, which did I mention that's also ARCH, which is a social worker and a paramedic. They go out in response to what could look like an if someone is seen sleeping and someone's not, they were seeing those folks anyway, and the point is to send them out rather than a police officer, because if someone has mental health issues or has had a lot of run-ins, been told they have to leave a lot of places, they might have some bias towards the police, and it could escalate a situation. And so having that social worker and paramedic helped. Susan Moore, the hospital outreach social worker, when someone is unhoused, they're more likely to have medical issues. We were finding a lot of people with diabetes, no way to keep their insulin cold. People with seizure disorders, that sort of stuff. People who are just cold or just really hot, going to the emergency room because there's no place else. And so having the hospital involved also made sense. And then the police, again, they're getting calls. So the mental health liaison, Julie Saxton, is another partner. Because again, some of the people that are unhoused can appear threatening and can be scary. In reality, they're more likely to be harmed than they are to harm. So that vulnerability, though, isn't necessarily always seen. So we, again, try to do wraparound services. We are seeing more and more people who are elderly and who have lost their housing. And once someone is unhoused, it's very difficult to become rehoused, especially if you have that eviction on your record. When you're in a community with college students and parents who can co-sign and can help those pay that rent, that's who's going to get chosen. And so unfortunately, when you're on a fixed income of $967 of SSI, and they want you to make 3 times the rent in income, basically that means you need to find a place for $330. They don't exist. So someone might have been paying their rent just fine, but they are asked to leave or their release is not renewed because of some behavioral things. Sometimes that's dementia, sometimes that's intellectual disability. Sometimes they're just really annoying and they just are causing a lot of problems, and the landlords just say, we can't do this anymore. And so we're seeing more and more. Everyone's correct. There are more and more people that are unhoused in this community. And we do need solutions, and we do need to figure out what to do. I want to make sure everyone understands this is your neighbors, though. I hear rumors all the time that these are not Story County people. These are not Ames residents. People are coming because we're so kind to them. Definitely there are some people that might be passing through. Everywhere, shelters are full. And Story County does have great resources, but we help Story County folks. Our funding, for example, the Salvation Army, is strictly for Story County residents. And so if someone is passing through, I might help with a bus ticket to help them go someplace, like if they know that they could, they have relatives in Wisconsin, things like that. People really don't want to be on the streets for the most part. One of the things we don't do is provide tents. So if you look at the list, we provide sleeping bags, we provide things like that. There's not a legal place in Ames to camp. So we're not going to set somebody up for that. So as sad as it sounds, like if someone's out in the rain, we haven't helped with a tent. I don't want to give them a solution that is just going to cause more problems. Now if someone has a car that they can stay in, we can help with gas. To keep it running when it's hot, to keep it running when it's too cold. We're working on like a heating and cooling center or something like that, somewhere for folks to go during the day. We kind of started it last year. We're still working on it. It's not as easy as you would think. So that's something that we're working on. The big thing is we're trying to find people where they're at, which does tend to be the library a lot of times, and meet them there. We give out food at the Salvation Army on a daily basis. Folks who are unhoused can come in because there's nowhere to store it. We started getting styrofoam coolers and freezing water bottles, things like that to help. Just the little ones, maybe your medicine comes in, people don't know what to do with. So that's been helpful. So we do that sort of stuff, and like I said, sleeping bags, just not tents. I don't have the numbers for the Bridge Home on how many people they sheltered. I can tell you that the Salvation Army provided shelter for 521 people between July of 24 and June 30th of 25. That fiscal year. So out of those, we were able to get 157 into permanent housing. So that was 60 households. So it can't, then that's all of us again. That's not just us, that's this whole team. We have folks from Optimi, we have folks from Mainstream Living, we have folks from Story County, 60 Forward. Different, I'm missing people, Ames High's homeless liaisons, a lot of folks, Mare House. come together on Fridays and say, here's who we've seen, here's who needs assistance, and we try to figure out what we can do. And so I think that's been a big part of what's going on. You can see over there as host, so they did move it in. I have the exact same shirt on in every photo, and yet they were different days. Apparently, I could not remember what shirt I had already worn. I almost wore it today. The group of us, like I said, you can kind of see what we do. This can give you some numbers. Really, what we're trying to do is go to that goal of permanent housing in a way that will fit whoever we're working with. Some folks, however, but only a couple, don't want that permanent housing, whether it's I would say it's a mental health issue, some distress, things like that. And so then we do what we can to make sure they don't freeze to death, they don't get overheated. But anybody that we can. Today there was a landlord roundtable. So that was a group of us, again, the Bridge Home, YSS, multiple agencies. Good Neighbor brought landlords in, and we just had a discussion of what can we do to help keep our folks in a home. And case management comes up everywhere, so I know you guys mentioned that too. Case management is something that there is not quite enough of. Agencies have some case management, but usually it's in whatever they serve. So if you serve someone who's unhoused, you have it while they're unhoused. Now they become housed, no case manager. So this is where Josh's position kind of comes in, and he'll talk about what Story County is doing to kind of address that lack of case management services. But again, I think the numbers speak for themselves, and my guess is you probably maybe have questions versus what I think you want to hear. So I'm going to go ahead and stop, and we'll let Josh go. And then if you do have questions, I can hopefully answer them.
Thank you, Kathy. So Josh is the Housing Stability Case Manager and Liaison at Story County, and he's going to talk to us about the homeless plan and the report, Conversations on Homelessness, as well as a little bit about what he does. Josh, go for it.
All right. Again, my name is Josh Oren, and so my role is working with Story County, so I work on more of a county level. So my official title is Housing Stability Case Manager / Liaison. It's a very, very brand new role. In fact, I think there are botflies that have lived longer than this role has existed. That's how new it is. I mean, this role also came apart as part of this plan I'm going to be talking about, and this was done in conjunction with Story County and City of Ames. They reached out to a firm to do some research, get some literature together, and just get a snapshot of what's going on with the homelessness and the housing in general, not just with Ames, but also in the county. So I'm going to be kind of going over that plan. And so I do recommend you guys read this plan. I mean, you just look it up on the City of Ames website. There's a copy for you to read. It's called Conversations on Homelessness 2025. Even if you just put that in Google, you should be able to find it. It's a pretty detailed plan, and like I'm always a sucker for plans because that's something we can actually work with instead of just saying, let's help the homelessness. And so while there's a lot to that plan that you can look over and go over, some things I'm going to highlight are the 5 themes of community needs that were seen. Dr. Amy Flowers, she noticed 5 themes coming up about what needs need to be addressed, and then she put in 9 recommendations of what we should do. It's not 9 steps, it's not 9 concrete plans, it's just 9 recommendations. And so I can also talk about what's being done now and what they're planning to do in the future with these steps. And so after that, I'm just going to go over the actionable steps that City of Ames has done and that Story County is doing and will be doing. And then after that, I'll be talking about my empowerment pilot program. So again, Conversations on Homelessness, it'll look like this on the website. This was done in conjunction with the City of Ames and Story County. They reached out to Dr. Amy Flowers, who is the president of Analytical Insight, which was a consulting firm. And so she went out and she just pulled data from the PIT count, from Asset, Iowa Finance Authority, and then interviewed stakeholders as part of the community, and then just got as much data as she could to just get a sense of what's going on in the county and Ames. They gave her a timeline of working from January to April of this year, I believe. So it wasn't really a big timeline, but I've been pretty impressed with some of the data she was able to pull from that. And again, so what she saw from when she did these interviews and got the data is looking at some of the 5 themes of what community needs we have. And a lot of these aren't going to be a surprise to some of you. But for one, provider coordination. So host was something of a result of this too. I mean, that's just one example of the provider coordination that's happening, is just having someone from all these agencies and other teams coming together and coordinating, all right, how can we help this individual? And so it puts more of the work on us instead of the person experiencing the homelessness, and having this team work with that individual instead of that individual having to feel like they need to visit the hospital, they need to visit this housing agency, and then they need to visit this financial assistance agency. And then another need that we saw is improving homelessness prevention. So you might hear it be heard, there's a couple of programs for financial assistance. One of them is homelessness prevention, because we've noticed that when someone does go into homeless or becomes homeless, it is much more difficult to get back into a place of stability, or even a place to just be on their feet, or a place they can call their own. So we're trying to divest some energy and money into trying to make sure they never get to that place. So, and that's part of where my job comes in, working with people who might be in housing instability, where, say, maybe they're, half a paycheck away from becoming homeless, or housing unstable, as we call it. I mean, I say that, but a lot of us are living from paycheck to paycheck, or even just one medical emergency away from ending up in a situation that many of the homeless people are. Another one we've seen, and this is something we've heard from a lot of landlords, is a need for increased case management. So while a lot of agencies can get people housed into places and then, common form of assistance doing like first month's rent, security deposit, a lot of what we see is that those agencies just don't have the time to work with that person after getting them housed, because they just have another need of more people that need to get housed. So it's not for a lack of want from agencies, but it's just from a lack of staff, resources, and just coming down to it, money. And so that's part of my role, is what we want to do. And we'll talk about it with my program, is that I want to do some of that case management once they're moved in. I mean, my plan with them is to sit down, do a budget, see what their finances look like, or if they're in need of assistance, how can we coordinate the assistance in the next month, or who can we connect them to so they can stay housed. So working with that person a couple months after they've moved in. So the ultimate goal is self-sufficiency. So instead of them having to be reliant on our services, we help them take control of their situation, and we are walking beside them and behind them, and not so much in front of them through their process. Another one we've seen is trying to expand emergency shelter. Not so much expand the time they're in the shelter, but just the capacity for it. I mean, already we're looking in some talks about how we can expand bed capacity. And again, emphasizing that shelter is an emergency solution and not a permanent one, because we don't want people to just be in shelter for months on end. Ultimately, we want it to be a stepping stone to their own self-sufficiency. And then finally, another need that we've seen is just need more use for programs like rapid rehousing, permanent supportive housing, and affordable housing. And so I've only been in this job for a little more than a month, but I have been in housing for full-time since 2018. And I can tell you from firsthand experience, these programs work. These are effective solutions to homelessness. I mean, that's not to say they are the systematic solutions to systematic problems that have popped up in the last 6 to 8 years, but they are effective when they are implemented. And so this report tells us about 9 steps that are coming through. Now, I could go through all of these one by one, but I'm really here to emphasize a couple of these, mainly some of the middle ones here, the expanding emergency shelter capacity, as I've already mentioned, but providing that robust case management across the county. So Ames has quite a wealth of resources for people when they may be experiencing homelessness. Part of my job is also going to the other towns outside of Ames, because we tend to forget that there are towns outside of Ames that are also legitimate. So I go visit the likes of Slater, Colo, Story City, Nevada, Huxley, and then seeing what I like to see is, what's the situation here compared to the homelessness situation over there. I was talking with Story City last week, and they told me they just found it a little funny that they did have one person come to their library who was experiencing homelessness, but he wasn't there for long because he told them he saw there was more resources in Ames, and he just said, they just treat me so nicely over there. So, I mean, it does say something that Ames is an urban core, so we just have more of that availability and resources. But there are still a couple of people in those towns that do experience homelessness, and so it's me trying to bring some of those resources we have in Ames to them over there. And then some other things I do want to touch on, so trying to support the developing efforts of an all-weather daytime refuge. Like, I can't give concrete plans on that yet, but that is something we have been talking about, and we're very aware of the timeline we're on, that it's the middle of October and the cold seasons are coming in. And so that is something we've been trying to put in some effort to as well. Well, not just some, but a lot of effort into, and trying to get that up as soon as possible. And then finally, once we get more solidified with how the rest of the plans can go, we want to plan and fund permanent supportive housing. And you know, this is always a great program when we get someone into permanent supportive housing. These are for the people experiencing homelessness that have a variety of things going on in their lives. So substance abuse, medical accommodations needed, mental health, and permanent supportive housing can greatly help with their cost of having to stay in that place. But not only that, just as a cost measure, but also providing them with support. I mean, I've worked with a couple of people in the Bridge Homes Permanent Supportive Housing Program, and it really is the best program for them as they try to get off of the drug disorders that they have, and also regain custody of their kids. So this is something I'm always excited to see more of, and we understand these are the kind of solutions, especially this here. It just takes time for this to come into place. And it's the thing where we're having the conversations now, and we might not see the fruits of that for another year or so. But it is something the county and the city are actively working towards. So to go over that, what the city of Ames has been doing, this is just a list of what it's been going through. So some of you may be familiar with Pa Goldbeck with City of Ames, and then some of you might realize I am not Pa Goldbeck. So if you do have some questions or some more detailed questions you want on this, I may not be able to answer that, but she would be a point of reference you can get in contact with. And so I've got her number and email with her permission. It's up there. But if you need to see it afterwards, just come see me after the presentation. But some things they have contributed, some things City of Ames have done is contribute $2.1 million in home funds for the creation of the Baker subdivision, so the townhomes at Creekside, so 40 low-income rental homes. Another one I want to point out is invested $2 million annually in human services activities. And then for another recent one that we've gone over in 2025, the council has dedicated $11,000 or $11.25 towards piloting a flex fund for HOST, and then in general helping support the efforts of HOST, and then continuing to convene on community partners and solutions around what they're doing. And then Story County's role in that is that this Board of Supervisors act as facilitators for stakeholders and organizations to direct housing strategies towards housing assessment study goals. And that also created the Housing Action Plan, or HAP. And so they meet monthly, or at least every 3 weeks, the HAP committee, to go over what's the best policies they can do to work towards this goal of trying to make housing more affordable. And then Board of Supervisors gives direction to staff to amend the Economic Development Process and Policies URA program, and then ultimately also using the ARPA funds that have been provided to further fund some of the programs that we've been utilizing to help the homelessness. And then finally, another part of this that came out of the plan is the Empowerment Pilot Program. So this is mainly what I'll be doing with my case management, is working with some of these people, meeting with them one-on-one. Ideally, these are going to be the ones who, you know, may not have the highest barriers, but are just on the cusp of getting out of homelessness. Mainly, I sit with them one-on-one, go over budget, see what's going on with their situation, and I've never seen two cases that were identical. I mean, we have one individual who may just want to rent an apartment, or we have a family who needs a small home for all their children. And so I work with them on an individual goal, and we try to break it down week by week. What would they like to accomplish? I always like to start at the end, you know, wildest dreams, where would you like to be for housing? What do you consider a home? Some say a one-bedroom apartment, some say small home of their own. And so we try to see how we can take steps towards that. And I work with them on what they can do week by week to reach that goal. And ultimately, how can we work with a realistic budget of what you currently have for income? And if they don't have income, what can we do to help them secure more, whether that be employment or applying for SSI or SSDI? And so some key features of that, well, me working with them directly, collaborating with hosts, and I can say, yeah, I meet with Kathy and the host team every Friday. As far as I've been going there, we've never left early because we do go one by one through each person and see how we can best help them in their situation. And like, I don't know about Kathy, but I leave that meeting feeling a little energized that we actually have something to work with these folks, instead of just saying like, all right, here's John Doe, here's Jane Doe, they're homeless, what can we do? No, we actually do try to see what we can do to help them out. And just going one by one just feels very boots on the ground effective towards working with these people. And then expansion of outreach to the rest of the county. So what Host is doing for the city of Ames is great. We want to be able to do this to other towns that might need it, say like Nevada or Huxley. There's no promise in that as of yet, but we're excited to look into that possibility. Another thing is, Kathy's mentioned that we've done hotel vouchers when the emergency shelters are full. Hotels are pretty expensive, especially on game days. We also run into the difficulty that hotels are booked up on game days, and it sucks because then they say, well, we don't have room. This person just might have to be on the street tonight. And they're very expensive, so the cheapest rates we can find sometimes is $70 a night. We're looking at $2,100 a month if we're having someone in a hotel for 30 days. But what we're wanting to do is work with some landlords who can do short-term leases, so ideally about 3 months, if they can do 6 months or so, or even down to 1 or 2 months. That would save just the city and the county a lot of money. So that is something we're trying to do, is get some short-term leases we can do with that. And then finally, I just work with other landlords, employers, and stakeholders, engagement, just to build some relationships and to also keep communication going between the service providers. So it's not just, well, what's Good Neighbor doing? What's Salvation Army doing? And then on top of that, trying to expand our partnership with the Iowa Works program. So that's something we're still trying to continue to develop to see if they can still bring that work mobile. If you've ever seen that, it's just like a little command center where they can use the laptop to apply for jobs or develop their skills as a potential employee. And thankfully, that is my time, so.
Well, thank you, all the presenters, for sharing this information this evening. So audience, it's your turn now to ask any questions that you have. Please.
I have a very general question. To what do you folks attribute the increase of homelessness in the last 2 years?
So the question was, to what do these folks attribute the increase of homelessness in the last 2 years?
So we do ask people what led to you being unhoused. And a lot of it has been increased rents, and then job. So a lot of employers are doing this great salary if you start, but yet anybody who's been in a job for quite a while, you're getting that 3% increase in salary, and yet your rent is going up quite a bit. And we understand the landlords talked about that today, that their costs are also going up, and so they have to raise the rents. I would say definitely it's systemic. It's not one thing. So finding a job when you've got 4 small children and can't afford the childcare, or there's not childcare, so childcare is an issue. A lot of the folks that we see do have some form of disability, so their income is fixed. So again, those they can't work and make a little extra money because of that disability. The families that we see, a lot of times one of the children will be disabled, which also makes it tougher to find childcare. Or if you're a single parent and you're constantly getting called to the school because of problems that your child is having, it's hard to maintain a job. So those are some of the things that we see. The way that Ames, so Story County itself doesn't necessarily have this. Nevada, Huxley, those places, you can pretty much get an apartment at any time. The leases are sort of whenever it's open, so we'll say that's March, you've got March to March. Ames is generally August 4th-ish to about July 26th to meet the needs of the students. If you become unhoused in February, you might not be able to get someplace until August. I think I mentioned earlier too, is we have a big pool of students whose parents can co-sign and who can pay those rents. And a lot of our folks don't have co-signers. They don't have good credit. A lot of them have evictions on their record because they will stay in a place even knowing that they're not paying because they don't want to be on the streets. They don't want to take their children out. And so they go through the court process. Once you've gone through that court process and you have that writ of eviction, you're not going to get someone to lease to you. Very few landlords don't do background checks. And so we try to connect them with legal aid and try to, again, if we know someone's gonna have to leave, see what we can do to get them out of there prior to court. But again, if you don't have anywhere to go and you don't want to be on the street, you're going to stay until the very last minute, until that sheriff says. I've been in homes with people trying to do case management as the sheriff shows up and just starts taking all of their stuff. And it's because it's scary. You know once you're out. So as much as we can work with them to not get that eviction, we try. Other times too, again, landlords can be picky. They don't have to take the folks with the felonies because they've got the students that don't have those. So I think those, I don't know, I just hit on several of them, but like everyone said, once someone is unhoused, very difficult to get rehoused. 30 days in a hotel, 30 days in the shelter, 60 days is not enough time to get them to where they're going to find someplace, and so they're out on the street.
Josh, do you want to add anything to that?
Yeah, I was going to say, so Kathy's pretty much highlighted a lot of the stuff I was going to say about that, but another part of it is just systemic issues as well. And I know that's a hard thing to talk about here because it's, you hear systemic, it's hard to think, well, what can I do to change something systemic? I mean, the fact federal minimum wage or even state of Iowa's minimum wage hasn't increased in over 10 years and rent is slowly going up, and like no part-time job is going to cover someone's rent for a month. And I'm just talking about an individual. For families, it's even worse. So trying to find ways where they can pay for that, or on top of that, if they do make that rent, they're not enjoying their lives much. I mean, if you've read Matthew Desmond's book, Evicted, he tells a very compassionate story about a woman who will sometimes just go out and buy a fancy lobster dinner because, she wants to be happy. She wants to have a meal that didn't taste a day or two old or taste like stale bread. And so it's hard for people that when they do live in poverty conditions, like their mental state is not doing well. So, I mean, not to detract too much from that, I mean, something I have noticed is it's not so much an increase in homelessness, but the visibility's just been more. When they're pushed out of their camps or places they're staying, or they feel unwelcome, they just go to the public places because they don't really have a choice. I mean, you can say technically they do have a choice, but when we are discouraging them from other choices, they feel like they don't. So part of that is also just a matter of like how policy is being done. I know nationally it's not going great. I mean, just trying to criminalize homelessness is not an effective solution. In fact, it's just going to make things worse as it goes on because it's just adding something to their record, and that's just not going to go well when landlords do background checks. And I think part of it is very unique with Ames is that we have a student population that they don't intentionally compete, but they're just a more reliable source of income for landlords. And so landlords, it's also trying to understand landlords' side is, they're trying to keep a business going, so they're going to go to the person that might be a more reliable source of info. Meanwhile, me and Kathy have to do a lot of schmoozing just to convince landlords, hey, this is someone that's worth renting to, or that we're going to be working with them. So, also I think a part of it that we also don't talk about is just what can we do as individuals to, help these people out. I mean, just on the very basic level, just recognizing these people's humanity. Just saying hello. I'm not asking you to give them a ride. I'm not asking you to give them $50, but they won't complain if you do. But I'm just asking you, just simply say hi, ask their name. Heck, you can even ask them what their favorite color or favorite shapes are. I know that sounds infantilizing, but I do that to my friends too, and that sparks a lot of debate.
Untreated mental health is a big thing too. I mean, we need more mental health counselors. We need more psychiatrists. All of these are fields that people burn out or that people just aren't going into. I do have a how you can help, actually, another flyer. But one of those things would be, if you notice someone on the street, you can email host and say, hey, I noticed somebody seems to be in this area overnight every night. Do you know about them? You can carry around, like when we make them, host cards and host brochures, we had them, we're redoing it, and give them to somebody that you see that's out there. So it can be just as simple as saying, hey, did you know that you can go to Food at First and get a meal? Did you know you can go to Romero House and get lunch? Things like that. And then I put on there some things you can help donate, just things like you have too many pots and pans, and you're like, I don't know what to do with them. When we take someone from the street, where all they've got is a backpack and a few items, and put them in a house with nothing, we're not helping necessarily. Yes, they've got a roof, but they've got no bed, they've got no sheets, they've got no noise, no TV, no anything like that. So just little things like that. We're really trying to do like a furniture bank or something. Right now, the Salvation Army has some space behind our building that is part of our rent, and that's where we're storing things. But if you happen to have a space you don't know what to do with it, it's just, those are some of the things that people don't always think about either. Just pots and pans, dishes, bedding. Beds, you can't get those in a thrift store used. So if we're trying, again, that's this group on Friday saying, hey, so-and-so just got a house. What do you have, or what can we give them? That's gonna help keep them in it so they're not right back out on the street.
I think one thing that's really interesting is that homelessness or being unhoused is experienced at the community level, but the policies and decisions about this are made at the national and state level. And there's a disconnect there that I'm not sure how we get over, but it's very interesting because when I hear this, I think, well, this is what's happening in Ames. But it seems like the decisions that are being made, they're not in Ames, they're not in Huxley, they're not in Slater, they're at the national level. Go ahead.
I'll direct this to Josh. Just trying to get a sense of the scope of what you're dealing with, you and your team dealing with all week long. How many people are on your to-do list to meet with one-on-one on a day-to-day basis, on a weekly basis?
Yeah, so I can speak. I mean, at the last host meeting, we were talking about 25 people, if I had my tally right. And that can fluctuate from week to week. Haven't started case management yet, but that's because we're trying to get the budget and paperwork finalized. But by the end of October is when we're trying to get that, and we're aiming at a caseload currently of about 25 to 35 people. Per week, yeah.
Yes, I have a question. One of you, I think it was Kathy, mentioned ARCH. Can you just tell us a short statement about ARCH?
So I can't remember what it stands for, which is...
Alternative Response to Community Health.
Thank you. Alternative Response to Community Health. And it's a paramedic and a social worker. They can go out to social workers if they don't have a paramedic, but they don't ever do just two paramedics. The point is to assist someone, hopefully without a police presence, in a way to, again, keep them calmer, de-escalate a situation, figure out what it is that they might need to avoid someone calling 911 on them, although you do get them by either calling 911 or the non-emergency Ames number. And the dispatchers kind of decide who, if it needs to be ARCH or an actual ambulance or the police department. But they do get a lot of calls about people who are unhoused, a lot of those, especially again in the winter or in the very, very hot days of the summer.
Thank you. Over here, we have a question?
Yes, where does childcare come into the plans? The people that need childcare?
So that's honestly an area where we need a lot more assistance. There's not a lot of openings in the childcare that does exist. Again, a lot of our folks have kids with some sort of a special need where maybe they need child service, the childcare. There's that application for for state assistance for childcare. And there's a couple. There's one if you're looking for work, there's one if you have employment. So negotiating those applications is something that we do. We use Center for Child Care Resources to look and see, like, I need somebody that does 3 p.m. to 11 p.m. Because that's the job I can get. There aren't a lot of those out there. So that's the thing. If you don't have a typical 9-to-5 job, it's even tougher to get childcare. So I would just say that's one area that we really, really struggle with. Not all agencies or individual providers will take state-funded clients. The state doesn't pay all that quickly. And that's because, again, we're talking about bureaucracy and ways that things need to be done, and it's cost reversible. You provide the service and then you get paid. Well, 60 days later, if that's all you do, you need that money right away. You can't necessarily wait. So there's a lot of things that go into that as well. So I would say that's an area we need to work more on.
I was not prepared to speak tonight, so bear with me. I find it interesting. Well, first I want to thank the League for doing this. I'm assuming it was the League and the library?
Yes.
Very important, and I hope it continues, this conversation. I find it interesting how I'm connecting with the panel. I was a resident in the historical area for a number of years. I also lived at Van Shell. I also worked at this library. I retired from here. I'm very familiar as a mental health, as some people know, as a mental health advocate, the value that Salvation Army does and Arch. I guess I just want to emphasize what a complex problem this is, and I see it so much more as a mental health advocate, how complicated the housing situation is. I have worked with landlords, begged them not to evict persons that are being evicted because they reached out and got a medical assistance brought into their apartment, but yet we're penalized. So it's very dear to my heart. Lastly, I want to say how Ann touched at that point. This is not just a city, it's not a county, it's not a state. This starts at a national level. Thank you.
Thank you.
I have no question.
We have another question in the back, please. I think we're really lucky to have this panel who has such a variety of experiences here at Ames, and I really want to thank all of you.
This is just a follow-up question to what one of the other ladies asked. You spoke about the number of cases that you have. Can you just give us a ballpark figure on the actual, like Story County-wide unhoused population versus the number of emergency beds that are available?
So I believe the Bridge Home has 17 beds for males. They just went up, 4 for females and 4. So families, they can do 3 adults and then children, or 3 families, depending on how many children there are. So like, for example, I have a woman in a hotel right now who has 6 children. When you have that, you can't put them in one hotel room either. You have to have the adjoining rooms. So then you're paying more. So when we talk about hotels being expensive, it's even more expensive. And we do number of hotels, again, so it's units. That family of 7 takes 7 units versus one person taking 1. So we run out of units faster when we have larger families. So I can't really say it's beds. Like I couldn't tell you like right now today, I can tell you what I have, which we're trying to conserve for the cold months. I know they did a point in time count. Do you have that exact number? Is it in there?
No, that was one we were trying to figure out because I know the numbers for this year said for Story County that there was 108 homeless people, and I know that's not an accurate number. And again, point in time count, it's only like a snapshot of what that looks like. And they always do it in the last week of January because their theory behind it is that it's just snapshot of the worst case scenario, who's homeless on the coldest night of the week, which
If
is,
you're actually on the streets
Right.
on that coldest night, then you're truly, literally homeless is what the logic is.
so even taking that number, when we have beds that are available in, say, Bridge Home, Access, Salvation Army doing hotels, comparing that, I know there's not 100 beds for that. And so that's always a tricky thing to have to balance with that. I know in my previous job, one thing, when I used to work at Access, we used to have to be very creative about it. Be in a hotel for 2 nights, have another shelter here for 2 nights, and then another shelter there. And while that's a workable solution, it's tough for the person who's facing homelessness, thinking, why am I being moved 3 times in 1 week?
Yes, over here.
I have a question. I know that a lot of people are homeless through not really their own fault. Maybe they're escaping an abusive relationship and having to get their kids out of there. But I am so terribly concerned about what Story County, Ames in particular, is doing for people in these coldest nights. I'm really, concerned. I mean, I know that Des Moines opens up shelters and actually has buses take people there, but it doesn't seem like Ames is doing anything other than you having to work with your already constrained budget.
So it's definitely something that we are meeting about and discussing. There's a potential Grandin, right? Funeral home? Am I saying that right? Behind that, it's called The Parlor. He doesn't necessarily advertise it, so it's a venue. They can use it as a lunch for a funeral, but right now, during December and January, he doesn't have anything planned. He's offering that as a potential space. The hope is it would be a daytime, like we would not have people overnight, because that's what hopefully the hotels and the shelters would be for. We want to keep a family with children in a hotel, not make them move around, not make them have to leave. The Bridge Home has said they have like a weather amnesty right now. Their policy is that they leave. Residents of the Bridge Home shelter leave from 8 a.m. to 4:30 p.m. During those cold weather times, they wouldn't have to. They also have what they call the Empowerment Command Center that they just kind of opened, and that worked, again, for the really hot days, and it can work for the cold days. The issue is it's got 1 bathroom, like 1 toilet. That doesn't work. And 1 entrance exit. You really need multiple. I mean, there's a lot of things. There are some cots that could be brought in through emergency management if we decided to do the overnight. The thing is, then you need volunteers, you need some mental health folks on board, you need possibly police to assist. People sometimes choose not to go into a place like because of an animal. They might have a dog or something like that. So there's a lot of things we have to look at, or they might have their space kind of staked out, and now we're saying you have to bring all of your stuff wherever you're gonna go to keep it safe so someone doesn't steal it. So there's so many things that go into why someone doesn't want to go into a warming center or cooling center. So many things that we have to put into place. And so those meetings take a long time because we're trying to figure out where can we put their animals? Where can we put their stuff? We're looking at fundraisers too, because who's gonna pay for the light bill? The Romero House is good at feeding people, that kind of stuff. So they've got a lot of those policies we could use, but as much as we all want it to be like an instant solution and be fixed, it's just not. Like as soon as we think we've got it figured out, then we think, oh no, what about this? And then you'll have people say, well, why can't they just go to the library? They're used to it. And that's not fair for the library. So there's so many, and I'm not even sure when that next committee, we were meeting on Tuesdays, it's been a little bit, but we're trying to look at Polk County's plan and what they do, but knowing that we have a lot different resources than Polk County does, because I think they just put $400,000 towards it, I believe. City doesn't have that. And then again, also looking at it isn't just Ames. In Story City, there's a hotel, so we can help people there when they are unhoused. If they're in Nevada, Huxley, they're gonna have to come to Ames. And then there's that transportation piece. You don't see as many people usually on the streets in Nevada or Huxley, Searing, Colo. They come to Ames because that's where they can find some places that are open 24 hours. You'll find people riding Ride all day, refusing to get off. And so there are all these things that we kind of have to figure out, like, so I don't even know how to tell you to get involved in that one exactly, because we know we need to, and we know it's coming up a lot faster. We started in June, and you'd think we would have this great solution, and we just don't.
Dave, you wanted to add something?
Yeah, so one thing I like to get straight, and I have it here, and I'm sure a lot of other people. So we have this strategic plan. My question is, who's in charge? And my advocation is that I really think the city of Ames, there should be a position in the city of Ames. Now, you have a position now with Story County?
Yeah.
Is that accurate?
Yeah.
So are you in charge of implementing this strategic plan at this point?
Oh, only like a small fraction of it. So as my understanding is, the Board of Supervisors with the county and some officials from City of Ames, Paul Goldbeck, are very involved with that.
Well, but who is the one person, if I had concern about homelessness in Story County or Ames, who do I call?
You can call me.
Okay.
Yeah, and you can also send me an email. I mean, yeah. Because I would love to hear a lot of this feedback, because part of my job is also hearing what the public has to say.
And you alluded to host. If I see somebody on the street and I want to let somebody know about them, I'm concerned, who do I contact?
So you can contact like the non-emergency dispatch number with the Ames PD, 515-239-5133.
And then they do what?
They will, if host is on duty, if it's that time, they will get a hold of host. Otherwise, if, again, last year, the part of that emergency weather plan was that the Ames PD could, so dispatch could contact Ames PD. They would contact first the Bridge Home to try to get them in there. And then if that didn't work, they would contact me, and then I would work on a hotel. We have a couple people who cannot go to hotels. The hotels have said they can't because they caused a lot of damage. Last year, we were able to keep everyone from freezing, though. We found something.
So for everybody's information, those emails and phone numbers are what?
They're right up here.
Let's just.
We got them.
There's
Okay,
Josh's.
Very good.
And I'm,
Everything else.
okay. So, do we have any more questions? One more. We'll take one more.
Oh, I don't know.
No, please, go ahead.
Okay. I was just curious.
Host has a Gmail, sorry, on the yellow sheet. So if you happen to get the yellow sheet, I did put that host Gmail on there. that is not checked 24 hours a day, however. So I really think if you think it's crucial, try that emergency dispatch, non-emergency dispatch number. Do you want, I can say it again if anybody wants me to. 515-239-5133.
Thank you.
I have it memorized because I call it a lot.
I figured that out, yeah.
I was just curious where the funding for host comes from and what the needed funding is.
Okay, so also on those yellow sheets is a QR code, which takes you to the city site that they created. And then in there's a way to donate, and that actually goes through the Mary Greeley Foundation. So, but it comes to host. You can specifically say, this is for host, and what the funds are used for are those things I mentioned, like the sleeping bags, like a winter coat, unless we've got them donated. We try very hard to utilize things that already exist. So whether that's donations, an agency that already has these things, it can also go for those few things that there isn't a source for, which would be IDs. There's not a source to get your birth certificate from California or somewhere else. It's usually like a $30 fee. The library provides bus passes. They have a much greater need than they have bus passes for. And so again, if someone can get to some of their places that they need to go, they're more likely to try to do that. And so those bus passes are great. A lot of times, so we've purchased some clothing gift cards from Overflow, and they'll match them and give us, so we purchase five $20 cards, they'll give us 5. The Loft and Duckworth Waring, they did the same thing. We purchased them and they gave them to us. The Salvation Army thrift store is not affiliated, so we're all Salvation Army, but if I send somebody there with a voucher, I'm paying the thrift store. Like, it's not, the funding is different. When you see the red kettles, that comes to us. And again, that can help with like hotels and things. But anyway, the thrift store will give 25% off when I send somebody with a voucher. So those types of things, even donating gift cards if you have them, like if we need to get a sleeping bag, if we need to get a Sub-Zero winter coat, we had some people donate. I have forgotten the place in the mall, that's a sporting goods store. What? No, the new one, the big, there you go. People did some gift cards there, and we could get those coats that keep you warm even when it's -30. So things like that, but even, again, used coats, snowmobile pants, like the overall Carhartt things that are warm, those are helpful.
And was part of your question, where does the money come from?
Oh yeah, so part of the City of Ames.
Yeah, City Council of Ames. Yeah.
And United Way did, like I said, last year United Way, I wrote a grant and we got some assistance from them as well, and I'll do the same thing for those that just don't exist out there, a funding source.
Okay, so this has been a very informative evening, and I want to thank our presenters, but I also want to take a moment to reflect on some of the things that I've heard. And this is what comes to my mind. When I graduated from college in 1979, my first job in California was to run a college dorm. Hardly a glamorous and well-paying situation. But I was paid $35,000 a year, and I got room, and I got to eat in the dining commons. Okay. Last week, Iowa State University, an institution that I think many in our community can relate to, sang the praises of a new major in something called digital storytelling. And they sung the praises of a $50,000 starting salary in this area. When I graduated in 1979 in California, you could buy a really nice house for about $140,000. That same house today would probably cost you, even in the crappy part of California that I'm from, Fresno, about $500,000. So Josh is right, there's a million stories. Each homeless person has their own story. But at the end of the day, there is one question. And that question is, how is it in a country that is so damn rich, we're talking about this problem in every community in our country, and the starting salary for a job for a college graduate between 1979 and 2025 has gone up $15,000 for comparable kind of work. And that's the real question, I think. And that's why at the League, we are looking at things at the issue level and why we're political but nonpartisan in asking these kind of tough questions. Because we rely an awful lot on these frontline workers to go out every day and deal with populations that are not easy to deal with. We ask a lot of them. We ask a lot of them. And I think we need to ask ourselves, how is this happening? So that's what I want to leave you with. And I want to thank the presenters again. I want to thank the Ames Public Library for hosting us this evening, and Anessa for providing us with this lovely taxpayer-supported place that we all are welcome to use. And hope that you have a wonderful evening and week, and that you feel that the time you invested here this evening was valuable. Thank you.
We want to thank you for the work you